Good morning, everybody. My name is Elizabeth Nyawade. I'm from Medway NHS Foundation Trust, and I'm here to share with you our journey for our financial well-being initiative that we put into place right from December 2016, how that is going and the impact that has had. But before I continue, it will be remiss of me not to say happy birthday to the NHS, 70 years today. So you can't miss that on the news or everywhere, and I'm really, really proud to be part of the NHS family, celebrating 70 years of the NHS today. I brought a little bag. Tom, can I just have that bag, please? When I walked to my local railway station today, they were handing out these beautiful well-being initiative bags, a bottle of water, and an orange. And that just reminded me how conscious we are today as a society of our own well-being, especially our physical well-being. It is absolutely everywhere you look. But what is not always visible is that the other side, the mental well-being that, looking at us here today, you can't tell who is perhaps mentally, stressed or who has worries that we cannot visibly see. There's always that other side of our well-being that is hidden to us, most of us, and part of that is what I'm going to share with you today about our financial well-being initiative at Medway NHS Foundation Trust. So our theme running through this is just why wouldn't you do this? Just why wouldn't you put this excellent initiative in place for our own staff? So just to give you a bit of context, in 2013, Medway NHS Foundation Trust was put into special measures. That's usually a marker to say things are not going very well in that organization. We need to do better from our staff, our monies, the care quality we give to the patients we serve in our local community. And so from a money point of view, it was not great. Our staff were not really engaged. We had high turnover, and there was really no focus across the organization on the well-being. Everybody was eyeing the money and also the care quality to our patients. So we looked at our strategic objectives within the organization, and a key one for us was the people element of it. In any organization, you're looking at your people who drive everything you do across the organization. So most organizations will have something about the staff who work there, and for us it was about making sure our recruitment is great, making sure we've got engagement, the talent management, all those things that go with a people strategy across many organizations. So we started looking at, we took a survey, talked to people across the organization, and some of you who are fairly familiar with the NHS remuneration package, it flows from band 1 to sort of band 9, with band 1 being your lowest paid employees across the organization. Now to put that into context, these are people who take home about 15K in a year. So we thought about this group of people, and we had 400 of them across the organization out of a population of about 4,600 staff. We thought the best thing to do is to listen to them to see what can we best do to engage not only that group of people, but all employees across the organization. So we thought about partnering with the best. We're also going to talk to you about the ongoing support we have in place and how we have evaluated this initiative that we have across the organization. So that just gives you a bit of context in terms of the size of the organization, and they are the 400 staff I mentioned who are all at this band 1 salary, which is about 15,000 per annum. Now, take your tax off that, and your take-home pay drops down to something like maybe £1,023 a month. And if you look at our geography, Medway is one of those fairly deprived areas across the UK, with about 1 in 5 children living in poverty. And that's also the area where we get most of our employees from, because we are one of the big employers across the in that geography area. So in November 2016, the leaders of the organization, and in particular our NHS director at the time, James Devine, decided to take a paper to the board to address this issue of having about 400 staff who are on the Band 1 pay, the impact that was having across on our retention, on our sort of presenteeism at work. We thought it was something we needed to address, having listened to staff in terms of what are their key issues, the key issues they're facing at work. So we took the paper to the board, and in November 2016, we put a moral case for the fact that it is really challenging to live on 15K in the local community, in that particular place, and still be present at work. And it was something that was well received by the board, mainly because we just articulated what living on £1,023 a month looks like in the day-to-day society. So think about that for a moment. I remember there were comments like, that £1,023 is perhaps how much I spend on just maybe buying alcohol throughout the year, or it's just the kind of money you spend on maybe leisurely activities. How many holidays does that buy you in a year? That's the kind of money some people are living on a day-to-day basis. So that was a really big one for us in terms of, addressing that, and given the pool of people we had in the organization, the 400 of them, that was a huge chunk of a group of staff in our organization. But what we also found was that this group of people, because they were very local to the organization, we had families in them. You had mothers, fathers, daughters, grandfathers, all working as part of that group, especially in our domestics, estates and facilities area. That's the area where we had most of these employees working in. So we realized that if we did something for this cohort, this group of people, our reputation as an organization was going to grow, but first and foremost, reducing sickness absence amongst this group and just stress-related absence amongst this group was something that was going to benefit our productivity as an organization. That was really, really key and important for us to address that bit. Now, what we had not perhaps envisaged was the impact of removing that Band 1 salary, that we abolished that 15,000K salary for these 400 people. We moved all of them to the Band 2 salary, which gave them an opportunity to earn 17,000K a year. And if you quantify that in terms of take-home salary, that was about an additional £700 these people had to play with across one financial year or one calendar year. And that made a huge, huge difference for those members of staff in our organization. It ended up being our recruitment strategy, because they went home in their local areas and talked about how great an employer we were, how caring as an employer we were to make that difference to them. In fact, it was something that they had not expected. They thought there was a big catch about it. So most of them were going around, is this really true that you've suddenly just abolished this level of pay and given us increased money? What's going to happen next? What is the catch behind this? What are you now telling us now that will come to bite us later? Such was the level of disbelief amongst this group of people. We tracked this, and we also realized that not only were they promoting our recruitment strategy, they went out and talked to people around them to come and work in this organization. That helped our recruitment strategy. They were more engaged at work. Productivity went up. They were feeling good about the place. The morale across the place really, really went up, and that really adds to your productivity in a way that, we benefited much more than not having done that initiative. So that was in 2016, December. Then we looked at ourselves as an employer and said, we are not specialists in the financial industry. We need to look around and partner with somebody who knows their gig here to come and add to this initial initiative that we had put into place. And that's how we partnered with Neyber in July 2017. We brought Neyber into the organization because of their expertise in the financial elements of things. So we set up an app for staff where they could go and tap into that financial expertise from Neyber that we didn't have. They could benefit from that advice from Neyber that we could not give them on all matters financial. And that alone added to that initial initiative that we had done in the organization from the point of view that it gave staff the privacy to go and talk about their financial elements that were worrying them, that mental wellness that we could not address as an NHS employer, the debt they had, because this is a key part of people's lives. It's the hidden part we don't see every day. But they had that opportunity to go and talk about how they could perhaps consolidate their debt, and perhaps how they could get better advice on what it is they need to do on financial matters. And that was just such a relief to the colleagues across the organization. I remember talking to one of the senior managers who said, do you know what, as a result of this, I have peace of mind. The relationship between me and my wife is better. As a man of the family, I feel I'm more in control now because he had just consolidated all his debt and he just used to have one payment coming off his salary directly go through the Neyber initiative. And the peace of mind and the discretionary effort you get from people like that is something you cannot quantify and share across board. It's just incredible. So those are some of the additional benefits we have seen as a result of partnering with Neyber, the financial experts who could do that alongside us for our employees. So on top of that, we run retirement seminars. We've got a staff app that people can tap into to get the advice they need. And also within our occupational health facilities, we've got private counseling rooms, which we didn't have before, where colleagues can talk about absolutely anything, including financial well-being, with our counselors. And to add to it, we thought it would be nice to train workplace listeners. Now, their role is to talk to colleagues right across the organization in terms of what's worrying you today and signpost people accordingly. And once people have developed that trust, once people believe you really, really care about them as an organization, lots of people open up. And we have seen so much traffic, so many of our colleagues tapping into the financial well-being initiative we have in place, and the associated benefits are just something I couldn't quantify and share with you guys. It's in listening to those stories and meeting the people who are benefiting from this that you realize how incredible such an initiative is to the workplace. So in terms of evaluation, we looked at the common one we do is an annual staff survey, widely renowned in the NHS. It's something we do once a year. And those are just some of the statistics already coming in from when we put this initiative in place. Now, a 3% increase in people saying, they believe the organization takes care of their well-being is incredible. Incredible from the point of view that the released discretionary effort you get from such colleagues is something that's just, it's priceless. It saves us money in tapping into temporary workforce because you have the people there. But above all is that reputation that builds our recruitment pipeline for people who are coming in to work in that organization. So those are some of the early statistics we have coming in and some of the quotes we have from people who've already benefited from this strategy. And that just really talks about our journey, where we started from and where we are today in terms of this well-being initiative, the financial strategy. It is something that many other NHS organizations, to date we have 8 other NHS organizations who've come to us to say, how did you do it? How did you present it to the board? How was this received? At a time when money is crucial in the NHS, this had an impact in terms of increasing our pay bill. How did your board agree to something that was going to add to their pay bill at a time when money is everything? But our key response to them is usually the fact that the board realized it is just morally wrong in this time and age to have a huge crowd of your people living off £1,023 a month. And, it's just something that did not sit well with our board. And despite the challenges, I'm really proud of the fact that they had the courage to take such a bold decision to improve the well-being of our staff at the place of work, because the returns to productivity and just the morale across the organization is something that we could not have bought or achieved without this initiative in place. It is ongoing. The support we have by partnering from Neyber has also really helped, because as an NHS, we don't have that financial expertise. So we signpost them, and it is something that so many people turn around when they can to look at, especially our executive directors, to say, thank you guys, this has saved my marriage, this has saved my home, I am so much more at peace now, I can come to work knowing I'll get on with it, consolidated all my debts, or I have a plan now for the future in terms of my savings. It has just given so many people hope. And with that hope, we have increased productivity at the place of work. So that's sort of our journey and what we're experiencing. Early days, but so far we've seen significant results, and it's something we are proud to share and would encourage many organizations to take it up, just as a result of the benefits we are seeing to the place of work. Thank you. Any questions? Yeah, there's one there.
Hi. I'm interested in the workplace listeners.
Yeah.
Can you tell us a bit more about how you chose them and what training you gave them, please?
Okay. So we put out, in terms of choosing them, we realized it is something that we need people to come forward to take. It was not something you could impose on people. So we advertised it across the organization to sort of say, this is the initiative, this is what we are thinking of doing. To be a workplace listener means you will be able to reach out to the different areas of the organization, be somebody who is approachable, willing to sit down and sort of listen to staff and bring the issues to the fore and signpost them accordingly. So it was very much in terms of who would like to take up this initiative, and the training we gave them was all in-house in terms of the key points you had to listening, be available, be prepared to sit and hear, all the things you do in terms of do the listening as opposed to the talking. And it's more about just listening and signposting accordingly to the different other setups we have within the organization to support staff. So it could be on anything. It could be on, personal worries. It could be on workplace related issues. It was really mainly to equip this group of people with the different avenues of support we have across the organization, educate them on those, and to also equip them on just spotting signs that could be sort of worrying signs amongst their colleagues. Maybe somebody who is a little quieter than they usually are. The occasional, how are you today? How are things for you? That type of approach is how sort of we train them to be out there on the lookout and to just signpost accordingly, really. So it's very much who would like to come forward. And we were inundated. We've got a total of about 42 workplace listeners across the different areas. We have doctors, consultants, we have, admin staff, we have porters who are all part of the workplace listening. Okay. Yeah, thank you.